Today, in the 39 countries that are easing restrictions in the European region, our behavior remains as important now as ever before. In short, our behavior, our choices determine where this road leads us and where it ends. I have 3 messages today. 1, there's no room for complacency. Remain vigilant. 2, authorities need to listen to their publics and adapt accordingly in real time. And 3, behave responsibly. We each shape the story of this pandemic. So to my first message today, we must remain vigilant. Over the past week, clusters of new cases have emerged in places, Wuhan and the Republic of Korea, where the virus had apparently disappeared. A timely reminder that the threat of virus resurgence is never far away. Vigilance and a continued determination to keep this virus at bay is needed as much during times of peak transmission as it is whilst restrictions are being eased. Until a vaccine or treatments are at hand for everyone, limiting the virus requires a partnership of people and policymakers, a social contract that extends beyond any government officials or leaders' ability to control. Vigilance is an all-of-society responsibility. Which brings me to my second message. Governments and authorities should employ ways to listen to their populations, earn trust, and plan their pandemic response measures informed by this. Situations change fast. Understanding how, why, and the context in which people and communities respond to different pandemic response interventions helps to inform government decisions, to shape communications, and to guide the planning of measures. That's why here at the WHO Regional Office for Europe, we have launched a tool to conduct regular surveys and listen to people's needs and concerns in these COVID-19 times. 20 countries are using this tool within our region and at least 20 outside it. The results are revealing. Take Germany. The country has been conducting weekly surveys since early March. Findings indicate that concern about the economic consequences of the restrictions remains high. This is set against declining worry and perceived risks from the virus itself and falling compliance with recommended behaviors. These social data generated by the surveys help to improve services to support mental health during the crisis, to develop material for families and children, to develop the content of websites for the elderly, to provide content for young people and dating, and to develop specific information on the right way of wearing, preserving, and cleaning facial masks. In the Netherlands, the social survey found willingness to comply with quarantine and isolation was very high, but that young males are the least willing to comply. The studies also reveal that Dutch children from disadvantaged backgrounds are hit harder by the school shutdown and should receive extra care when schools reopen. The United Kingdom government has established an advisory group, the Scientific Pandemic Influenza Group on Behavioral Science, and the UK's Department of Health has conducted weekly surveys looking at attitudes and awareness with input from behavioral and psychological scientists. A host of institutions and centers across Europe have considered how behavioral science can help tackle COVID-19. Among them, the Economic and Social Research Institute in Ireland, that found that adherence to measures was most likely when there is clear and frequent communication, strong group identity, and social disapproval for those who do not comply. This, of course, has implications for language, leadership, and day-to-day social interaction that can make or break the success and impact of a government policy or measure. More countries are about to embark on regular surveys with WHO support, including Azerbaijan, Albania, Bosnia and Herzegovina, Bulgaria, Kazakhstan, Kyrgyzstan, the Russian Federation and Ukraine. And as these countries move towards transition and adjusting pandemic measures, the insights gained will be highly valuable in informing decisions and ensuring these measures are appropriate. My third message is this: we each have a role to play in keeping the virus at bay. We are now at the fork in the road. This is the point at which our actions and individual behavior determines which path we follow. One that sees us head towards a new normal, or one that sends us back to restrictions on our movement and social interactions. Emergency fatigue threatens the precious gains we have made against this virus. Reports of distrust in authorities and conspiracy thinking are fueling movements against social and physical distancing. Other people are behaving overcautiously, which continues to limit their social interactions and access to health services, for example. Mistrust, resistance to measures, a disregard for the behavioral changes we have all made to limit COVID-19 will send us down the road no one of us want to take. Simply put, our behavior today will set the course for the pandemic. As governments lift restrictions, you, the people, become the main actors. It's an individual as well as a collective responsibility. Do follow the recommendations of your national authorities. Limit social interactions. Keep washing your hands. Maintain physical distancing and reduce risk to the most vulnerable in our society, the elderly and those with chronic underlying health conditions. They rely on the choices you make. So my three messages today. 1. Communities, remain vigilant and protect the gains. Our complacency is COVID-19's playground. 2. Policymakers, keep attuned to what people are doing. Listen, learn and adjust measures accordingly. 3. To us all, we all have a role to play to keep COVID-19 at bay. Our behavior determines COVID-19 behavior. It's up to us now. Thank you.
Thank you very much, Regional Director. So we're going to go to the questions and answers session now, and we're joined by Richard Pebbody and Katrine Habersat online. The first question I'm going to take that was sent to us in advance from Konstantinos Davanis from ERT, Hellenic Public Television. And this is over to you, Richard Pebbody. Richard, Konstantinos asks, in Europe and Greece, the tourist season is about to start as Greece already has low transmission rates. Greece suggests tourists taking a test 3 days before the trip. Is this considered an appropriate way to protect visitors and residents of the country? I don't think it's just Greece that have asked us this question recently, but many other member states, particularly those in the Mediterranean region. So over to you, Richard.
Thank you very much, Rob. So this is a question which is arising in a number of different countries as we move into the summer season, and quite rightly, countries and people are wondering about their summer vacations. Clearly, this really needs to be undertaken involving a very careful risk assessment by the countries involved, involving understanding what the local transmission is, and also close interaction as well with the countries where tourists are going to be arriving from. So no clear answer here. It's really for Greece to consider where the tourists are coming from, a local risk assessment, and based on that, make decisions on helping to support the local economy, which of course is really important. over and out.
Thank you very much, Richard. Okay, I'm going to go to the journalists that are joining us online, and first over to Antonio Neves from the Lusa News Agency. Antonio, can you hear us?
Hello, good morning. Can you hear me?
We can. A little bit louder, please. We're having the volume's quite low on all the previous, on Richard as well, so a little bit louder, please.
Okay, I'll try. My question is, what can you tell us about the lasting effects of COVID-19, namely on people who have been hospitalized and put on ICUs? And what should the health services do to keep following these people once they're discharged and tested negative? Thank you.
Good question. Thanks very much, Antonio. Right, Richard, over to you, and a little bit more volume, please. Thank you.
Okay. Thank you very much. Thank you for the question, a really important question, actually, around the long-term health effects of COVID-19. This is really a key area. It's becoming very clear that COVID-19 does have potentially long-term health effects. Following up patients who have been hospitalized and who have been in intensive care is extremely important to understand the health impact. A number of countries are working together together with WHO to undertake these types of studies. So the data is really just emerging. And this will need to go on in the coming weeks and months so that we can fully understand the burden that COVID-19 is resulting in over and out.
Thanks very much, Richard. The next question I have is from Robin Cooper in London, UK, and it's to you, Katrine. And it reads, we start hearing about pandemic fatigue. I think that Regional Director also mentioned this in his statement regarding emergency fatigue or pandemic fatigue. We start hearing about pandemic fatigue in many countries. What is that, and what can be done about it? Katrine Habasat, please.
Yeah, thank you very much, Rob. It's a very good question, and it's one that we're hearing increasingly from countries as well. And I think perhaps the point is that the pandemic fatigue is actually expressing itself in different ways in different countries, and that brings us back to the point that we're suggesting countries to conduct surveys regularly, and we've developed a tool for countries to do that, to understand what drives behaviors and perhaps more importantly, what the barriers are that people are facing or the fatigue that they are facing. And it's important to note that we can see in these surveys that it's not just about motivation or having sufficient knowledge. The barriers can relate to your mental health and well-being, being isolated, being alone, not being able to draw on the social support that you usually get. It can relate to your economic situation and the need to put bread on the table, or it can be related to cultural or social pressure to engage in social activities. It can be very difficult to navigate those competing interests. And so basically, we recommend countries to conduct surveys to understand that and to use what they learn in their decision making. And that way, we believe that the pandemic response strategy will be more well-informed, well-accepted, and hopefully more effective in affecting people's behaviors and controlling virus transmission and ultimately protecting our loved ones.
Thanks very much, Katrine. We'll go over next to Bloomberg News. Naomi Krestja's with us. Naomi, welcome back. Please go ahead.
Hi, good morning. Thanks for taking my question. So Sanofi told us yesterday that the US would probably be the first to get vaccine if Sanofi is successful in developing one, because the US was the first to fund their research. And I wondered what your view on this is and how you think that vaccine access should be prioritized. And then a second question, if I may, I wondered what the most important measures are of whether countries have got it right with their post-lockdown strategies, whether we should be looking at infection numbers or if there's something else that would be more important. Thank you.
Okay, thanks very much. Thanks very much, Naomi. I'm going to pass both of those questions to Richard. Richard, did you get that? We'll take. If I could pass the floor to you, please.
Yeah, no, great. Thanks, Rob. So I'll take the second question first. So in relation to the question of lockdowns and when to ease them and what indicators countries should use, WHO actually has just released the latest guidance, or their guidance, on the indicators countries should use. They fall into three broad groups. One is, as you say, the sort of the rates of infection. This is best summarized by this indicator, the effective reproductive number, but there are various associated indicators for that. The second group relate to indicators associated with the capacity of the health system. So that's the capacity of the health system to potentially cope with an increase in cases if countries start to ease their physical and social distancing measures. And the third group of indicators relate to the capacity of the public health system, and this is really critical. The public health system to trace the cases and follow up on the contacts and ensure that those are being appropriately managed. So it's those three groups of indicators that are really important for countries to ensure that they're monitoring once they start their slow process of easing lockdowns. And to your first question in relation to vaccine development, WHO is working very closely with a range of partners in this area. We're aware of a large number of products that are under development, over 100, and a number of those are in clinical trial. And very encouraging, but still some distance to go before we have a vaccine available, which is available for the world, and as you say, it is available at scale for the populations across the countries, the member states of WHO across the world. Access is a really important issue, and again something that's being directly looked at by the vaccine team within WHO. Over and out.
Thanks very much, Richard. Okay, we'll next go across to the Cyprus News Agency and Avi Mitsoudou Phillips. Avi, please go ahead.
Hello, thank you for taking my question. I'm going to go back to the Mediterranean, surprisingly, and ask, as the summer approaches and lockdown measures are easing down, I think many people are really looking forward to enjoying their time in the sun and the sea. And what I would like is your advice about how best to do that. Thank you.
Okay, Richard, I'm going to go to Richard first, and then I'm going to go to Katrine to add a few points on this from the behavioural perspective. So Richard first, please.
Yeah, again, it's a great and important question. Of course, it very much depends on the local situation, the extent of transmission of COVID-19, and the local measures that a particular country has in place, how much of the lockdown measures may have been eased, and so on. But whatever there is, there are still the core underlying measures that people should undertake, and those, of course, relate to the issues of ensuring that the usual physical distancing measures are put in place, the 1 meter rule, and that all the usual measures as well around sort of hand and respiratory hygiene to help to reduce the transmission of the virus. And of course, there's the measures which the local authorities need to endeavour to have in place to ensure that the beaches and places where people might gather are a safe environment to, again, try to minimise any risks of onward transmission. Over and out.
Katrine, would you like to add to that?
Well, I can certainly try to. So the way I understand your question is that if we have people who would really want to engage in a social activity that is actually against the recommended behaviour, how can we then cope with that? And I think there are two things that need to be considered in that. I think, first of all, we need to make sure that we listen to the public and understand the fatigue or the barriers that they're facing and the competing interests that they're facing, and their needs at some point to also be able to engage in activities that are important for their mental health and well-being. So that's the one thing that we can try and understand where they're coming from and where that need is coming from and how important it is. The other thing, of course, is how can we continue to find ways of appealing to people so that they follow our recommendations. And there are many ways of doing that. And again, through doing surveys, we can understand who do people trust, what are the prevailing norms, are there any trends or shifts in norms where we can see that there is a declining willingness to follow recommendations. And if there is, we need to do something about it. And so I think countries are doing a lot of brilliant things to try and make sure people follow recommendations. And one of those things may be to understand who do people trust, and what are the role models, the trusted people, the religious leaders, the community leaders, the influencers who can help strengthen social norms in a way that will make people follow the recommendations so that we can continue to control transmission while still perhaps allowing people to engage in some social activity.
Okay, thanks very much indeed to both of you. I'm next going to go over to Denise Rowland at the Wall Street Journal. Denise?
Oh, hello, can you hear me?
We can. Please go ahead.
Naomi's question really a priority access to the vaccine, which I know goes against what the WHO has advocated for, which is equal access. But I just want to know, when the reality is that governments have to sort of secure their own access at the end of the day, what is the alternative model? What could be? What is? Are there any precedents, or what could be the mechanism for really distributing a vaccine in a way that is fair?
Okay, I'll go to the regional director with that question.
That's a tremendously timely question. Also, what we have seen from previous pandemics, the WHO Director General, Dr. Tedros, together with the President of the European Commission, Madame von der Leyen, and with the Gates Foundation, Mr. Gates launched the Access to COVID-19 Tools Accelerator. It's called ACT, and that's exactly aiming at a global collaboration to accelerate the development, production, and equal access to new COVID-19 diagnostics, therapeutics, and vaccines. And that was launched the 24th of April. In addition, under the leadership of the President of Costa Rica, there is going to be a call for action which advocates for the vaccine to be what we call a global public good. And that's definitely something that WHO is subscribing to.
Thank you very much. Okay, so next I'm going to go over to Ryan Hooper, PA. Ryan, welcome back. Can you hear us, Ryan?
I can. I think I've just been unmuted. Yes, I think this is me for Trine. Are there any concerns about the behavioural characteristics of people who have perhaps spent 10 to 12 weeks, perhaps longer, socialising and having physical contact largely only with people in their households, who are suddenly being given the access to mix in much larger groups when lockdown restrictions are lifted? Thank you.
Okay, thanks for the question, Ryan. Over to you, Katrine. Yes,
most certainly. That is a key issue, and if we look at some of the scenarios that we've been looking at, we can see, if you consider a continuum let's say, reactions in this transition phase that we're looking ahead, we can see that we're worried at the one end of the continuum. We're worried that people will be so eager to go back to social interaction and will enjoy it so much, and they'll maybe even want to do even more than before. And then at the other end of the continuum, we're actually worried that some people, and we can see that in our surveys, there's a division where a group of people are also, they continue to be so worried that they still do not see people who rely on them for social support. They don't go to the doctor for a vaccination or other potentially life-saving interventions. So actually, through the entire continuum, we see scenarios that are worrying in this transition phase ahead. And that actually just underlines the need to be very aware of the trends and the shifts in the sentiment in the population and in the behaviors in the population so that you can respond to them early on. We also see that some countries, they're now detecting or identifying issues that relate maybe more to conspiracy thinking or even stigma against certain population groups. That's something that you need to be able to detect early on and respond to early on, because obviously all of these issues that I was describing on this continuum of reactions can lead to a difficulty in controlling transmission.
Regional Director.
Right. So, Ryan, what you also have to remember is if the people are now coming outside, what happened the last 10 to 12 weeks behind the closed doors? For example, on mental health, but also on interpersonal violence. We know that in so-called peace times, 1 out of 4 women, 1 out of 3 children are faced with some kind of domestic violence or intimate sexual violence. So that is something which definitely needs a lot of the attention of the health and social care services, but ultimately of the whole society to reach out and to be there for the people who were already disadvantaged, hit by the COVID-19, and maybe double hit because of those, what we call determinants of ill health.
Thank you very much. Thanks for the question and the answers. So I'm going to go over to Judith Serjansky, who submitted a question to us from Club Radio in Hungary. And the question is to you, Richard. And it reads, though the death rate was high in the most critical days in Hungary due to the novel coronavirus, now we are going to a new phase by easing the restrictions and the lockdown. Can your data of Hungary reassure the optimism for ending the lockdown? What is your advice to the people of Hungary? Richard, please.
Yeah, Rob, yeah, thank you very much for the question. So yeah, looking at the data from Hungary, Hungary's reported over 3,000 confirmed cases and 430, sadly, confirmed deaths. But encouragingly, the rate of infection has been declining in Hungary in recent times, in recent weeks. And that's very much reflects, obviously, the measures and so on that have been undertaken by both the Hungarian government and the Hungarian people. Hungary is obviously looking now at relaxing the measures that they've introduced in terms of the social and physical distancing measures. That's very much should be done very carefully and cautiously, as WHO is advising. Of course, it will allow people to hopefully start to do the things that they haven't been able to do for some time. But at the same time, as mentioned earlier, really important just to ensure that people still remain alert and that the other measures, in particular the isolation of cases, the investigation of them, the detection of those individuals and the follow-up of the contacts remains in place to try to keep transmission under control. And allow the gradual relaxation of the physical distancing measures to take place. Over and out.
Thanks very much. Okay, we'll next go over to the Czech news agency, Alice Zapotoki. Alice, are you with us? Alice, you might be on mute.
Good morning.
Thanks.
Good morning. Good morning. You hear me?
We do. Please go ahead.
Okay, perfect. Thank you very much. Thank you for the opportunity to join the briefing. I would like to I would like ask you two questions. WHO emergencies expert Mike Ryan told yesterday that the virus may become endemic in our communities and may never go away. Do you have any recommendation for states for permanent preventive measures to manage the virus and to cope with it in the future? And the second, could you please comment on the opening of the EU's internal borders and the promises of the EU that we will have summer tourist season? Thank you very much.
Okay, we'll go to our regional director for a response to that. Thank you.
Right, we have to realize that we are living in a planet full of viruses. So as of today, no one knows, but the option is there. The virus may also become what we call endemic, like a number of seasonal viruses from the corona group, is one option. Other option is it can't mutate, but the key issue is that it's an interplay between the virus, how it behaves, how the people, the human population is behaving, and very important, the interventions, because that's also something that we can influence. The lesson here is no time for celebration, but time for preparation. Because it's not the first time that the world is facing a pandemic, but definitely this has been a very, very devastating one. So even if we have few cases, we have seen that the strongest health systems can be overwhelmed in a couple of weeks. So the preparedness of the health system capacity and the public health capacity like surveillance is crucial here. That's the key issue.
Thanks very much, Regional Director. And Richard, maybe to the question of the EU internal borders, I think you've answered this partly already, but cross-border movement of populations, would you like to comment on that?
Yeah, no, of course. So yeah, thank you very much for this question. Yeah, as you say, I mean, this is linked to the holiday season, but also actually to more widely to other areas of cross-border traffic. And clearly, this is important, and WHO welcomes these types of initiatives. It's important for the health and well-being and also economic activity as well. But at the same time, it obviously needs a very careful risk assessment to ensure that this doesn't accelerate transmission of the virus. And we're encouraged by these discussions that go hand in hand with these careful risk assessments to ensure that the acceleration of transmission doesn't happen. Over and out.
Thank you very much. Next, I'm going to go over to Anna Pinto. Anna?
Hi.
Hey.
My question is about travel too. The European Commission issued yesterday its guidance on how to safely resume travel. And one of the recommendations is that member states could allow citizens from areas with a similar overall risk profile. I would like to know if looking to this similar epidemic risk profile is something that WHO recommends. I mean, coming from a specific country, would it be an indicator that that person presents a higher risk? Should the country ban the entrance of citizens from places where the COVID-19 is not being tamed? And isn't there a risk of labeling people who would be being punished by their governance mistakes? Thank you so much.
Thank you very much, Anna. Richard, would you like to respond to Anna, please? Thank you.
Yeah, no, of course. And this is a complex area, and it needs a number of different issues need to be taken into account. As mentioned before, it's really important at the same time that these discussions do happen and that there is active consideration around how potentially things can open up. WHO ourselves are in very close discussion with travel, aviation and tourism sectors, and involved in helping them to update their guidance around these particular issues. So I think it's very much an evolving area, one that will change over time as the epidemic evolves. Over and out.
Okay, thanks very much. I've got a question here from POS TV in Georgia. It's also for you, Richard. Coronavirus is already being fought by all countries in the world. Is Georgia on the list of successful countries in the fight against the pandemic? And how can you evaluate the method of treatment of Georgian doctors? You got that?
Sorry, Rob, could you just the start? Yeah.
Sure. Maybe we take this in two parts, or I think I've got the gist of it. But coronavirus is already being fought by all countries in the world. Is Georgia on the list of successful countries in the fight against the pandemic? Can you say, do you have any...
We've got some, that's right. So, I mean, Georgia has had over 600 detections of coronavirus since the start of March, and 11 confirmed deaths. The rate of infection has been dropping off in Georgia, which reflects the measures that Georgia has been introducing, both in terms of detecting cases and following up on the close contacts, and also the associated social and physical distancing measures that the country introduced. So again, the same messages come from WHO around once those measures start to be eased, that it's done carefully and slowly, watching very carefully the unfolding epidemiology, and to ensure that there isn't the risk of an upsurge, a second wave. But certainly Georgia is doing well in terms of managing the epidemic at this point in time.
Thanks very much. I'm going to keep you on the spot because I have another question for you from Konstantinos Davanis from Hellenic Public Television. Can you give us an update picture of the progress of vaccines and drugs against coronavirus? I think you've done this a little bit with the vaccines, but maybe on the treatment side against coronavirus, as we are already hearing about ready-made vaccines and traditional medicine drugs.
Yeah, of course. So again, having an effective treatment is clearly a really important goal as well. WHO is involved in coordinating with partners an international trial called the Solidarity Trial, which is looking at a number of different potential interventions with a number of different agents. And we're hoping that results of that will become available in the coming weeks, which will potentially provide options for clinicians to manage patients who are seriously unwell with COVID-19 infection. Over and out.
Okay, thanks very much. We're going to take a question now from Tom Magno. Welcome back, Tom, from Kara's World. Tom, are you with us? I don't think we have Tom. Tom, you might be on mute. Tom, we can see you, but we can't hear you, I think. Oh. So with that, I'm going to close today's press briefing. Thanks to you all for joining us. We are back next on Thursday, the 28th of May, when we're hoping that you'll be able to join us at that point. With sincere thanks to joining us. In the meantime, please take care and look after yourselves, and we'll see you on the 28th of May. Thanks.